Welcome back to the channel. What are some of the signs that I can see in my skin that will let me know whether I'm starting to have low testosterone, or maybe I'm becoming diabetic, or I'm having high blood pressure or high cholesterol? Are there skin signs that we can actually look for that will let you know that? Well, welcome back. I'm Dr. O. I'm here at Angelic Wellness, and if you're new to the channel, please hit that subscribe button and that like button and join our free school VIP group where we teach more about topics like this one, okay? So there are some signs or things that I can see in a patient's skin as soon as they walk into my clinic, where I'm immediately suspecting, might be diabetes going on here, or I need to check this one's blood pressure, or oh, the cholesterol must be through the roof, and so on, okay? So what are the signs? Let's talk about some of them today so that we can actually maybe catch it in ourselves so we can go get checked out. So the first one I want to talk about is low testosterone. Most people don't even know you could look at someone's skin and know that their testosterone is low. But because this is an area where I spend a lot of time in my practice, I love to help patients replace their hormones because, oh my God, not only do they feel better, they look better, right? Because the changes that we see in their skin will let us know that, yes, their hormone is becoming more optimal. And I also do laser aesthetic treatments, and I always find out that the patients that their hormones are balanced are the ones that get the best response to the laser therapies. So of course I started paying more and more attention to the patient's skin to see what might be a reason for me to say, okay, you know what, I think we should check some blood work before we start your laser therapy because I'm suspecting some hormone deficiencies. Okay, so let's get into it. So the first one is just dryness, okay? When I see a patient and their skin is very, very dry, of course, I'm going to think about they might just be dehydrated, maybe they don't drink enough water, but that's an easy question. I'm like, how much water do you drink a day, right? So they're able to tell me, oh yeah, I love water. I drink this much, jug or whatnot. Oh, I hate water. I never drink water. I only drink sodas or tea or coffee, right? So dryness in the skin will let me know if someone might potentially be dehydrated, or it could also be a sign of low testosterone. Then this one is thinning, right? Thinning skin. Okay, why does that tell me someone might be deficient in hormones? Well, because testosterone as well as estrogen are very, very important in stimulating your cells, the skin cells, to make collagen. Okay, so collagen, elastin, and fibroblasts, these structures, these proteins in your skin are very important to keep that integrity of your skin, the bounce back of your skin, right? But if I start to see thin skin, oh yes, I know hormones are being depleted, right? And especially if the patient is now in that age where I'm like, okay, menopause probably hit, or andropause has hit in case of men. Well, yes, I'm going to start suspecting that thinning of the skin might be due to loss of collagen, which in turn means that the stimulation from the hormone is dwindled. Okay, so more than likely that patient has low testosterone. I also see, like exaggerated wrinkling, right? So when there is so much wrinkling for your age that we're like, you shouldn't look this old yet. I mean, you're only, whatever that age is, right? So we see excessive sagging of the skin, right? If we start seeing that at a young age, more than likely hormone is deficient, okay? Because just like baby skin don't sag, baby skin don't wrinkle, right? Teenagers don't have wrinkles and saggy skin. Why? Because hormones are very balanced in this age group, right? So as you lose the testosterone, you lose the estrogen, we do see sagging skin. We see wrinkles, deep wrinkles, right, in this patient population. So those are things I can immediately you walk into my clinic, I'm picking up right away. I'm going, yeah, we need a hormone panel, okay? So we're checking it and then confirming that that is truly what's going on. Now, in some patients, one might be low, might be two, might be three, might be all of the hormones, but we have to check to make sure which ones are low, and I commonly find testosterone being low, okay? So that's very important because everybody thinks, oh, it's all estrogen that has to do with wrinkles. No, no, no. Testosterone is also very important. Okay, so now let's talk about what kind of skin changes do I see in a diabetic patient. So in a diabetic patient, one of the most common things that I find, especially in those that have not yet been diagnosed, is something we call acanthosis nigricans. Okay, acanthosis nigricans is basically a darkening or discoloration of the skin, usually around the neck towards the back, that we see that just looks like, how you think somebody just didn't take a good enough bath and you think they need to, wash a little bit cleaner. I find a lot of moms do this to their kids, right? So they will have a kid that's starting to develop insulin resistance and diabetes, and they keep trying to get the kid to clean their neck better and wash, and they give them new baths, new soap, new this to try to wash that dirty looking skin off. But it's not dirty looking skin. It is a skin change, a discoloration deep into the skin that is letting you know, oh, this blood sugar is sitting here way too long, it's sitting here way too high. We need to get this insulin resistance dealt with, okay? So when I see the patients in my clinic and I immediately notice that, I'm going, oh, we gotta add some diabetes screen to your blood panel, okay? Something else that might tip us off as doctors is a patient that keeps calling and they keep getting boils, right? Folliculosis we call it. This boil in the skin, and they keep getting recurrently, just recurrent infection, or they easily get infected, or they easily get fungal infection. They constantly coming back for treating yeast, vaginal yeast, skin yeast, toenail fungus, and so on, right? The patient keeps coming back for that. We start to suspect that they have this problem, right? They have diabetes. So also, we can see poor wound healing, right? Someone cut themselves and it's taking forever, longer than 6 weeks to heal. That is a sign that someone might be diabetic, because most of the time, most people will heal, in less than 6 weeks. We start to see someone's wound not close properly, or it closes and opens back up, and closes and opens back up. We are suspecting that there might be some underlying insulin resistance or diabetes, okay? And then there's skin tags. Some of you have noticed skin tags start to show up on your skin. No, don't just go try to get this sniffed off. You need to get your blood sugar checked, okay? That might just be the only sign that you're starting to have a metabolic problem that is going to lead you to diabetes, okay? So we start to work on your insulin resistance, your diet, your lifestyle. Right away, we start seeing those skin tags. All right, so every now and then we'll find some patients where all we can find on their body is some, yellow discoloration, maybe brown, red spots, or patches of skin that just has no explanation. You've not bumped yourself, there's nothing, you just wake up and you're seeing patches of skin that just have different colorations. So those are sometimes the signs that you might be developing diabetes. So as far as high blood pressure, what can I see in someone's skin that will make me suspect high blood pressure? Very commonly, especially if the patient is Caucasian, they're white or pale, you will see some facial flushing. Okay, so you meet this person and they're always looking flushed and red all the time. It could be, right? It could be one of the signs that we see. We could also see some red spots we call petechiae on the skin. This looks like little pink dot redness, kind of in random places all over the body. Can be seen on the face too, but also in the arms and extremities. We start to worry about high blood pressure in those patients. Or the patient is just sweating, right? They sweat excessively. They're not super overweight, maybe they're not sweating because they're just heavy. They're just like maybe normal weight and they just pour a lot of sweat all the time. Especially if the sweating is on the forehead all the time. They're just constantly pouring sweat. Okay, that might be signs that I would be like, let's check your blood pressure. And not just in the office. I will have them check their blood pressure at home, maybe for 2 weeks straight, where they're checking it at home first thing in the morning when they wake up. And then look at those numbers and decide whether this person really does have an underlying undiagnosed high blood pressure, okay? So next one I want to touch on, so I don't make this video too long, is what signs can I see in patients that maybe have high cholesterol? Okay, so without blood test, someone walks into my office and they're chit-chatting with me about whatever has brought them in today, and I'm looking at them, I'm going, those deposits around your eye, those yellow things I'm seeing right there on both sides, right on top of your eye. Yeah, you mentioned you've had it for a while, or it runs in your family. Yes, that is actually something we call xanthelasma. I'm pronouncing it slowly so you can follow me, okay? Xanthelasma is kind of the cholesterol deposits in the skin around the eye that tells us that someone's cholesterol level is way up there, okay? So we can check their blood level to then confirm it. Most of the time, patients that have this usually have family members that have it too, and they already know that cholesterol runs in their family, or if they don't know that that's what it is, we're quickly able to educate them, right? And then there's also xanthomas, which is just deposit of, cholesterol deposit anywhere on the skin. Doesn't have to be just around the eyes. Okay, so xanthomas means anywhere on the skin, where xanthelasma, usually we're referring to the one that's on the face, usually around the eye, and that is a sign of high cholesterol in some patients, right? So not all patients are going to have all these symptoms that I've talked about today, of course, right? Some patients will never have any symptom. They will not show any signs on their skin that will let us know they have this problem. But these are things that we can easily, walking by, being at a party, we can go, I hope they've asked their doctor about that one, So, and you can start picking them up too, but don't make fun of anyone now. Just be like, I might want to share this video with them. All right, guys. If you've seen anyone with any of these things that I've said, or you know someone in your family that might need to know about this, please share this video with them. Make a comment in the comment section, and I would love to read your comments. If you have pictures to share, even better, okay? So I'll see you guys on the next one. Bye for now.